Okay. So I'm Dr. Sattah, and I'm an ICU doctor by training, but I switched into functional medicine a, a few years ago, kind of after the pandemic and after seeing some of the limitations in what we could do for our patients. And since then, I have started to look into some of the things that we can do to help optimize brain health. So we're going to do a little bit of an introduction on genomics and brain health, and and then talk about how this can be applied to autism and ADHD in largely in this situation in a pediatric population, but a lot of this is applicable to adults as well. And I'll talk some, and then I'll introduce you to Silvia Hazel, who's a nurse practitioner that I have worked with for several years. She's been in the functional medicine space for a long time and has a lot of experience in this field. So we'll go through a little bit of an introduction. I want to talk some about limitations in the research model for conventional medicine and the way that we approach research, and how some of the alternatives to that approach. Then we'll talk about what it looks like to try to create health. And then I'm going to introduce you to Silvia Hazel, who will give you a better sense of that more holistic approach. And we'll go back to saying, what do we do for individuality and like addressing things in the specific individual in front of you? And that's where I think genomics can be really valuable. And I'll walk you through two case reports, one of which is a case report for a 6-year-old with autism, and the other is a case report for a 37-year-old who has ADHD and anxiety. And then we'll break for questions and go from there. So thanks for joining us. So this is a statistic that many people may be familiar with, and it's referring to the rise of autism in the US over the last about 20 years or so. And this used to be a fairly rare diagnosis, maybe 1 in 100 or 150 children. Now it's estimated to be 1 in 36 children, and that rate just continues to rise. And some of that may be an increase in awareness or an increase in diagnosis, but I don't think that that's the whole picture. So what do you do about that? And that kind of trend is not necessarily unique to autism, because you can look at all sorts of curves for mental health disorders or ADHD or anxiety, and you can see the same rise. It may not be quite as stark as in autism, but I think something is changing. And how do we address that? And in an ideal world, we would like to say that we could come up with customized treatments for every person and know in advance what's going to work. And, this is a little bit simplified, but to know the right, pink pill for the pink person and the green pill for the green person. And if you could figure that out in advance, that would be ideal. But in reality, there's an awful lot of trial and error. And along the way, people end up with a lot of side effects, or you start on a medication where you feel like it should work, but then the patient has side effects. So you add an extra medication to deal with the side effects. And how do we unravel that? And what happens frequently is if we do research studies using randomized placebo-controlled trials, which is kind of the gold standard for research and evidence, you have to make some level, or at some level, you have to assume this general population is sort of statistically similar to the person in front of you. And so you take a whole bunch of unique individuals and you kind of blend them all together to get a sense of what the population as a whole is like. And that blended up result might not actually look like any of them. In this, I mean, if these were paints, then the muddy brown paint that you have created when you put all the colors of the rainbow in there doesn't look like any of the colors that you started with, but it's the statistical average. And I think that's one of the limitations we see in research. The other thing we see is if you're looking at traditional medicine, when penicillin was invented, this was absolute game changing. Like you had a bacterial infection, childbed fever, or septic shock, and that person was going to die. And if we didn't have a solution, they would get septic and they would die, and it's game over. And so when they developed penicillin, it was such a groundbreaking advance in medicine that then we kept looking and saying, well, what other treatments like this can we find out or can we discover? And we kept looking for a silver bullet. But that assumes that there's one cause. And what happens with chronic disease, and you could put autism in here, you could put cognitive decline, you could put mental health disorders, any number of chronic diseases, they have a lot of different potential contributing factors. And so you're not looking for one treatment. And if you do a randomized placebo-controlled trial of one intervention, it's not going to be sufficient. And you really need potentially dozens of interventions. So functional medicine ends up using a much more holistic approach where it says, yeah, we have to optimize all these things that are just fundamentals of health. Like, regardless of your diagnosis, everybody needs to have a good nutrition program. We need to have stress management. Our bodies need to be able to clear toxins and to have a balanced GI tract and have some movement and energetics and emotional connections and social interactions, and all of that is necessary for a healthy human. But how do you intervene on that? It's not something that honestly I was really taught much in medical school, because we're so focused on the pathology and how to get to what is your diagnosis, what is the code for that diagnosis, what is the treatment, the prescription, the surgery, the imaging study I need to order. And so we have to back up a little bit and say, what are the precursors for health? And so with that, I want to transfer things over to Silvia. She's got a lot of background in that kind of holistic approach, and she'll talk about some specifics. And so I will hand it over to her.
Thank you, Dr. Sattah. Let me just pull up my screen here.
And I should let you guys know, Silvia is wonderful. She helped us when our daughters, or one of our daughters was a baby and had definitely was having some issues with regulation and emotional regulation, and working with Silvia really changed the course of her life. And so it's really a pleasure for me to introduce you all to her.
Thank you. So we're going to talk about this idea of unlocking potential and how functional medicine supports the autistic and ADHD nervous systems. This is a really important thing, I think, to address, because we often see that there's a few different camps going on as far as autism is concerned, and things like ADHD and neurotypes. And so just kind of moving into that a little bit, I think a big thing that I want to say is that this whole idea is that if we look at autism and ADHD as a neurotype, meaning we're looking at how the brain processes and integrates information, not necessarily a deficit. And then within that spectrum of how that brain processes information, we either have more agency in how we use the brain or less agency. And so what we're looking at here when we talk about things like detox, the immune system, infections, etc., those are things that are going to cause less agency to be had within the brain. We're going to have increased inflammation. We're going to have less capacity to choose how we want to react to stimuli, etc. So I just wanted to make that distinction right off the bat. We have internal and external environments that are going to be affecting us. So for instance, we know in the psychiatric field that often, like, chronic PTSD and the way that the nervous system integrates information can oftentimes look very similar to autism or ADHD. So there's external stimuli, and then there's internal. So our nervous system is constantly kind of searching through the internal environment. What pathogens are there? What toxins are there? Does there need to be cause for inflammation? What's the immune system doing? So that's kind of just a basic framework of what we understand to be happening in the human body, no matter who you are. Safety, agency, regulation, and connection are all kind of put together, and that develops into what our sense of safety is. And this is going to be the foundation for which that nervous system works. We look at theories like polyvagal theory, neuroplasticity, and all of these kind of show how the body's able to adapt to internal stimuli and external stimuli at the same time. Okay, so cell danger response and stuck healing. This is the basis off of so many different diseases that we can think of. A lot of autoimmune diseases, a lot of just immune diseases, mental health disorders. Also, autism is one of these that we believe from research that the cell gets stuck in this place of threat. The cell gets kind of stuck in this place where instead of rebounding and going back into a state of healing, creating cellular energy, decreasing inflammation, the immune system goes back to its normal function, that it can kind of get stuck in with this on switch. And we don't really have a great way to turn it back off again. So this means that we're having increased amounts of chronic inflammation, we have impaired detox, brain fog, fatigue, the mitochondria, which are the important components of the cell that create cellular energy, and that leads to the whole physical body's energy, they start to signal danger instead of recovery, which is a huge, huge problem, because then that's going to send signals throughout the body that the whole body is in a state of danger. So supporting resolution is foundational in terms of healing. So what that means is not just removing what turned the switch on to begin with, but oftentimes turning the switch off is just as big of a piece of the healing journey as figuring out what turned the switch on to begin with. Okay, so environmental load detox challenges in autism and ADHD. We know quite a few things about autism and ADHD and genetics and genomics behind it. And one thing that we do know is that impaired detoxification is very common. If any of you have ever heard of MTHFR, this is one of our SNPs that impacts how we metabolize folate within our body and how we convert it into a form that our bodies use. We know that there's a very high proportion of the ASD population that has more inefficient SNPs to this MTHFR gene. So that's just one example, but there's lots of others that play into this role. Higher toxic burdens because of these impaired detox pathways is really a big problem. So we're more likely to hold on to heavy metals, mold, pesticides within the body. And then toxins don't just impact, these detox pathways. It's not just gut, it's not just lymph. What ends up happening is that it gets backed up all the way to the cellular level. It starts backing up the mitochondria, so the mitochondria are not able to create energy in the way that they really need to. The immune system, and we'll see this, I think it's in the next slide, then gets all, confused. And so we're talking about autism and ADHD here, but we could easily be talking about any autoimmune disease under the sun. And then behavior, behavior is one of the more classic things that we think of when we think of autism and ADHD. And what we know is that our neurotransmitters, our brain chemicals, are very much impacted by an abundance of toxins within the body. So functional medicine in support of these pathways looks to target like safety toxin drainage. So gut health is going to be a huge one. We're always eliminating things through the gut. We look at the liver, the gallbladder, all of these players that come in. Then we look at lymphatic drainage. How are we moving toxins throughout the body? Are we storing them in tissues? Do they need to be pulled out? So all of these different pieces are incorporated into whatever treatment. So this is the immune seesaw. And if you were an immunologist, you would say, wow, this is an oversimplification of this. And it is, but it isn't. This is really important. So Th1 is considered the branch of the immune system that is responsible for fighting off infections, helping our bodies detox in certain types of toxins. Th2 is the side of the immune system that tends to be more inflammatory. So we have allergies, autoimmunities, cancers comes out of this Th2 dominance, hyperinflammation, even sensitivities to foods and smells and substances and things like that. So when we look at it almost like a seesaw, when we have things like infections, chronic stealthy-like infections, I'm thinking of things like tick-borne illnesses. I'm thinking of viruses that tend to, COVID is one that we've started to see tip the scale, things like that. And then certain types of toxins, like again, mold, heavy metals. I tend to see it mostly with mold. Heavy metals tends to take advantage of the mold environment or other sorts of infectious environments. And what we see happens is that this seesaw gets stuck in this position. So this is what we're talking about when we're talking about that switch getting stuck on. We're turning on that cell danger response. We're getting this seesaw stuck. And so not only, again, do we have to figure out what are the contributing factors that led to this state, but also how do we rewrite the seesaw? And luckily, as far as I'm concerned, and from what I've seen throughout the integrative and functional medicine field over the past several years, we're getting more and more in our tool belt as far as rewriting this immune system. So a lot of it, just like with any autoimmune disease, we require gut work, there's detox, nervous system support. If we can almost imagine things like ADHD, autism, and again, any autoimmune disease to be like a four-legged stool, we have leaky gut. There's always the presence of some sort of leaky gut because that's coming into contact with the immune system. We've got nervous system that is foundationally out of balance that we need to work on. We've got a trigger, so some sort of other type of trigger, whether that's an infection, whether that's a toxin that took advantage of this immune system. And then we have to kind of bring it all together, and that's what's led to this state here. Okay, so the gut-brain axis. This is obviously a very simple picture just of what the gut looks like. But the biggest thing that I want to show you is here. So I think you guys can see my cursor, but this is basically what's considered a tight junction. In our gut, we have cells that are right next to each other, and they're held together by tight junctions, what you see right here. But over a period of time and from various different factors, the food that we eat, antibiotics, yada, 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 I can list forever, these tight junctions start to get broken in a way, and they start to separate. And these cells, as you see here, start to have more space between them, meaning anything that goes into your GI tract then can come and encounter with the bloodstream down below. And once it has a chance to encounter the bloodstream, well, your immune system automatically is going to start responding to it. So even if it wasn't something that with the tight junctions together, you wouldn't be allergic to, all of a sudden your immune system's now encountering so much more. There's so much more possibility for reactions, things like that. And then if they're inflammatory foods, then we're going to start stimulating the immune system more and more and more and more up till it gets to the point where it's confused. And again, we're stuck in this seesaw. The other thing to notice about is that leaky gut can definitely impact brain fog, irritability, and nervous system regulation. Again, so much of our brain chemicals are made within the gut that it just makes sense that this is going to play a huge role. Food sensitivities can also contribute to glutamate. So this is a big player. Glutamate is our most abundant excitatory neurotransmitter in the brain. So when we're thinking about certain types of what we would consider like behavioral presentations of autism, for example, stimming, a lot of stimming, hand flapping, a lot of that we can consider to be glutamate driven. There are other brain chemicals that play a huge role in this as well, but there is a lot of glutamate that plays a role here too. And a lot of our glutamate is stimulated from the foods that we eat. So this is an important player when we're looking at supporting folks with autism. So GI healing and food mapping can help calm the system. Typically, this is not something we guess at. We usually do some GI gut testing to look at things a little bit further. So the language of the body, sensory needs and regulation, this obviously is something that we're starting to become more conscientious about, and just making sure that the nervous system has what it needs. Obviously, we have different sensory needs across the spectrum, and also just in our humanness. We have people who are sensory seekers. We have people who are very sensory sensitive, or they have auditory processing issues or visual processing issues. These are all things to kind of take into account. And when whether we're parents, whether we're providers, are interacting with a child or with a human who has autism or ADHD, having awareness around the overwhelm that their nervous system could potentially be feeling in that moment, and recognizing it as dysregulation instead of recognizing it as defiance or whatever other words that we want to attach to it, can be really affirming. And even if we think that the individual may not understand, there's so many ways that we can make this individual feel supported. So sensory diets, doing rituals around certain types of transitionary time periods, co-regulation, whether it's with a parent, whether it's with a sibling or something along those lines. Obviously, adult siblings, we don't want children to have to take on that role. But these are core tools in helping stabilize that nervous system, which is going to be a humongous part of this individual feeling supported and being able to emerge into their most beautiful and highest potential self. Vagal tone, again, this is this nerve that runs from our brain all the way down through our body and regulates digestion and so many other things. This is a great tool to access that more social engagement nervous system, get the body out of fight or flight and out of this freeze state. So this is another great tool for both ADHD and autistic individuals. So just kind of a little recap here, a functional and holistic support for autistic and ADHD individuals. We're going to work on inflammation and balancing that immune system. We're going to work on toxins, infections, and the gut. Methylation, this is what I talked a little bit about earlier in terms of those B vitamins and folate specifically. We're going to make sure that we're supported from a methylation standpoint. We're going to check in on those mitochondria and make sure that they're generating energy. And if not, we need to figure out where the holdup is. Where is that whole system backed up? We're going to do some detox and nervous system work. And then the important thing here is that integrative care is going to honor both biology and identity. Again, just like Dr. Sattah was saying earlier, protocols are great for what we would imagine a person to be like, but what about the individual standing in front of us? That's going to be the most important thing. And safety allows a true self to emerge and thrive. So again, bottom line is safety. That's going to be physiologic safety. So what's happening within the body that is telling the nervous system that we are unsafe. That can be toxins, infections, etc. And external safety. We're going to work on all of that. Okay, so I just wanted to share this one little case study. This is Amelia on the left in the green boots. Her mom came to me probably when she was like 18 months old. And at this point, they had been really struggling for the past 6 months. Her mom came to me, she said that she, was developing great up until she got her 1-year-old shots. She had a round of antibiotics for an ear infection. And then they also were suspicious of some mold in the basement. So all of these kind of different pieces coming together. And all of a sudden they started noticing that both of their twin girls actually at the same time started losing what words they did have. They started head banging to the point of like nosebleeds. They started losing eye contact. And as her mom described it to me, she basically said that what personalities started to emerge as like these beautiful, bright little children, she just like saw completely fade away. And that's really heartbreaking. But basically, when all this happened, we went through the history. We decided that we needed to do some detox for Amelia. And mom's job was to look into the home and see what was going on from a mold perspective, which they did. And This is a urine mycotoxin profile that we did. This showed basically very high levels of ochre toxin, which this is a toxin that comes back positive on a lot of people. Not to say that it's not significant, but it certainly does come back on a lot of people. And then 2 different types of toxins that are common in penicillium mold. So sterigamatocystin and then mycophenolic acid both came back positive. We started Amelia on a nice little gentle detox. And luckily, you know, I feel like a lot of the times with parents, it can be, you know, with my kid, I'm like, let's get this done. You know, you want to do it so fast. You want to get in there. You want to put all the things, you want to get it going. And really the bottom line is that our bodies don't tolerate that great. You know, our bodies don't tolerate when we throw a bunch of things at it at once. So luckily, the parents were so great about being like really just slow and gentle. And she did wonderfully. So we rebalanced the immune system by downregulating Th2 and upregulating Th1. We did this through herbs. And then I did end up putting her on naltrexone, low dose naltrexone, which was a really supportive thing for her. We went through some mold detox. We upregulated glutathione production with this really wonderful product that I love using for kids. And then they removed the mold in their home. And at the same time, she was getting PT/OT and speech the whole time. And mom and dad were really open to anything that they needed to do in order to support her. So this is Amelia now. She's, I think, about 5 years old now. And mom has said multiple times that all of her therapists have said that she appears as though most of the like defining characteristics of her autism are not there anymore. Now, that's not to say that the neurotype of autism is not, but she has a lot more agency in choosing how she shows up in this world. She's a smiley, bubbly little girl. She's happy. Her sister is also happy because mom did the same thing for her sister as she did for Amelia. And they're extremely pleased. They are at the point where I'm telling them, you can probably come off of some of these things at this point, but mom's like, no, we're keeping her on them. And that's okay because most of the things are safe. But this is a great example of how when we look into history, when we bring you know, the individual person and we put a supportive plan in place, how amazing results we can get. And that is it for my part. Yeah.
Thank you. That's so sweet. You were mentioning the mycotoxins, and I know we had gotten mycotoxins back on my little one. And for as much as I had studied them, and I'm like, I understand them, or I understand what they do, when you see those toxins come back and it's your daughter's name on the report, I remember being just terrified. And it was so reassuring to meet with Silvia and just to feel like, okay, there's a plan. I don't have to figure this out for myself. I have somebody who knows how to deal with this. And within about 6 months, my daughter seemed to be a very, very different person and much, much happier. And I think this is really impressive. The other thing is, in all my training, and I feel like I did a lot of medical training before I found functional medicine, I never heard of mycotoxins. I never really heard of mold illness. Like maybe some people would get asthma, but that was kind of the extent of it. And one of the toxins that Silvia just showed you is mycophenolic acid. And that is the same thing that we create a transplant medication from. And there's a transplant drug called mycophenolate mofetil, which is Cellcept. And I used to give this in the hospital all the time for our organ transplant patients. And when you see that level and you say, this is for real an immunosuppressant, like we use it as an immunosuppressant, we have to monitor levels and check for side effects. It's a real thing. And so when patients come in and they say they've had frequent colds and flus and they're just always sick all of the time and they can't ever seem to get well, and you start to be worried about mold illness, or there were a bunch of water damaged buildings, or their home leaked a couple of times, And I just have that in the back of my mind that some of those things that grow in water damaged buildings are very potent, and getting them out is really helpful. So thanks, Silvia. That was great.
Thank you.
Let's see. All right. Am I sharing my screen this time? So, okay. So I want to just build on that and talk about other ways to try to figure out what's different about people, because everyone who comes in is going to have their own unique tendencies. And I show this diagram as, you know, if you have a whole room full of people that have some level of exposure, so whether it's an exposure to COVID or to a COVID infection, or it's an exposure to a toxin or to water damage, or whatever that exposure is, you can have a large fraction of those patients who are totally fine. And then you have one person who has that same exposure and they develop a chronic disease. And if you're one of the people over in this group, you can look and say, well, I don't see how that's possible. I had that same thing happen to me and I was fine, so it couldn't be that. And that just isn't, it doesn't reflect the reality of what we see in a lot of patients with chronic disease. And then when you look and you say, what's different about that one individual? Well, there tend to be a lot of things that are different. And so trying to tease out what's the best intervention for each individual is going to depend partly on their prior history, what happened that led them up to the time that they had this exposure, what was unique about their genetics, their gut health at the time, their antibiotic exposure, all of those different factors that Silvia was talking about. And now I'm going to talk a little bit about how we can look at genomics to get yet another level of insight. And Intelligx DNA is a company that has done a ton of research into different gene variants. If you've heard the term SNP, it stands for single nucleotide polymorphism. It's basically a single letter misspelling of a gene. And it can affect the function of that gene, but maybe not necessarily completely knock it out. It just is a little bit of a gimpy version, or it's a little less efficient than what another version might have been. And so they've done a lot of research into many, many different SNPs. And then what do you do about them? Because you can go to 23andMe and for $99 or $199, you can get a report that says, here's your genome sequence. But if you don't know what to do with that, then it's just a phone book and it's not really that clinically useful. And so this is looked at, what do you do with some of that information and how do you intervene on it? And they've published a couple of papers. These were both, or I believe they were both done in Australia, and they were using genomic information to try to help further improve the treatment and the protocols for patients with autism spectrum disorder. And they show substantial improvements in behavior and outcomes similar to the case that we just talked about with Amelia, where maybe 100% of things aren't reversed, but you start to go back to a much more normal pathway of development. And I think that's the goal. So I want to present a case of Erica, and that's not her real name, but this is a real 6-year-old who had mild autism spectrum disorder. This was characterized by a lot of repetitive behaviors, lots of gut issues with intermittent diarrhea, anxiety, and then a lot of these symptoms would flare whenever she was sick, and sometimes there was an obvious trigger like an illness or infection, and then sometimes there was no apparent trigger and it just seemed to sort of happen randomly. And I think that means that we just don't know what the trigger was. And so she got one of these Intelligx tests, or these genomic tests. And there are a lot of different things you can look at. They have a medical panel. They have a panel that's looking at brain optimization for cognitive decline. But what we're going to talk about tonight is they call it a neurodevelopmental panel. And so it includes many of the gene variants related to mental health, and also a lot of the gene variants related to autism, as well as PANS and PANDAS, which is pediatric neuropsychiatric disorders and syndromes. And this whole panel is over 600 different genetic variants. So I 100% do not know all of these, but I don't need to. And I just want to show you this. And so they had done a genomics test to try to get more insight into what to do about it. And these are the results. And it's a pretty in-depth test because it starts looking at gene variants that we know are specifically associated with autism, but there are genes that are associated with folate receptors, and there are genes related to PANS and PANDAS, which are neuropsychiatric conditions that seem to be associated with infection. There are genetic variants that play a role in attention and focus, stress and anxiety, as well as a lot of different nutrients and how those nutrients are transported through the body. There are ways of looking at how good your body is at clearing toxins, histamine response, which is an exaggerated kind of allergic response. So there's a huge amount of information in here. And if you open up any one of these panels, you can see that there are potentially dozens of genes that are involved. And so you have to figure out, well, how do you find the genes that are the most relevant for any particular patient? And one thing that's really nice about Intelix is that it gives you the frequency of the genes. So you can find those things that are the most unique about your particular patient. And in this patient, the thing that popped up, actually, that was the strongest contributor, or at least the most unusual thing about her, is actually in the inflammation panel and not in the autism panel. If you open this up, there are a lot of genes, and the way this is organized is it's giving you the specific gene here, plus it's telling you the frequency in the population. So in this case, she has 2 copies of the GG variant of a gene called CCL2, and that's only present in 8.8% of the population, and she has 2 copies of it. And this red color just means that it is a fairly clinically significant gene, that it leads to at least a doubling of your risk of a particular condition. And then you can find out more information about what that does and potential interventions. But I want to go down to this one. This is TNF alpha. And she has 2 copies of this gene variant, which is only present in 0.8%, so less than 1% of the population. She's here in this little sliver. And that gene variant causes her body to overexpress TNF alpha, which can lead to excessive inflammation. And when you have an overabundance of inflammation, then you can end up with more tissue damage associated with that inflammation. And that can lead to things like an increase in breakdown of the blood-brain barrier. So there's increased permeability of things getting across that barrier into the brain. There's also a higher tendency to have a breakdown of the gut barrier and the intestinal barrier, which is frequently referred to as leaky gut. And if that was it, then I think this test wouldn't be that useful. But if you can go through and say, all right, we know that's a weakness for this person, but what do we do about that? And then you can pull up interventions. And there are actually dozens of interventions. So you can use lion's mane, which is a mushroom, and it's been used in medicinal traditions for quite a long time. But when they've researched it, they realize it actually lowers TNF alpha, which is her specific risk factor, and it's able to get across the blood-brain barrier where it needs to do its job. There are some other plant-based compounds that also do that. You can look at curcumin, which is from turmeric, which is widely used as an anti-inflammatory. And magnesium threonate, which is a form of magnesium that helps get across the blood-brain barrier better. Sulforaphane is a plant compound from cruciferous vegetables, and you can eat cruciferous vegetables or you can take it as a supplement. And typically, if you had this level of gene variant, I'd probably recommend it as a supplement because it's a much higher dose, but it would be very safe. There are a lot of other things that have been researched. There are dietary interventions like capsaicin, which is from chili peppers, that helps lower that factor. I don't know that you're going to get a 6-year-old to eat a lot of chili peppers, but if you had an older patient who had these same risk factors, that might be a good option. And then there are some potential prescription medications. So pioglitazone, which is an anti-diabetic medication, can at times be used. And so you get all sorts of research, and there are references along all of these to say, well, where did these recommendations come from? And I just want to show you a handful of these, because in this patient, that inflammatory gene was pretty unusual. She also had a gene called TRIM33, and that's up in the autism panel. And TRIM33, let me just pull it up. It is right here. So this causes your body to overexpress IL-17. And this is a level of detail that I think as a patient, you don't necessarily want or need to have, but it's useful for your provider to know this stuff. And if you produce too much of that cytokine, then you will go on to produce too much TGF-beta, which drives inflammation. And when we see that, then we say, okay, well, what do we do about that overexpression of TGF-beta? And there are several things. So cinnamon helps to lower that. Narogenin, which is from citrus fruit, lowers it. Resolvins, which are downstream byproducts of omega-3s and fish oil, helps to shut down that inflammation once it's been triggered. And then there are different foods that you can add in. So you could customize a plan based on the specific genetic variabilities for any individual to try to get the best outcomes. I'll just show you one more example while we're here. This in the neurobehavioral panel, which is right here. And it involves a gene called GABR3, which, let me find it. Okay. So this has to do with one of the GABA receptors. And GABA is a neurotransmitter in the brain that's very calming. And so it's kind of that feeling like right before you're about to go to sleep and you just feel relaxed and calm. And so you want to have decent GABA signaling in the brain. And if the receptors for the GABA are impaired, and so you can't receive that signal to calm down, then that can lead to this overexcited state. And so if we see that she has some problems with that GABA signaling pathway, how do we address that? And there are a lot of ways we can do that. Taurine is an amino acid, but it helps to support or helps to stimulate those same receptors. And that's actually been used in some genetic syndromes where there's actually a complete deletion of this gene and not just a slowed down, less effective version of it. There are different probiotics, and all probiotics are not the same because they're all different species in the body, but Lactobacillus rhamnosum and Bifidobacterium longum have both been shown to increase GABA synthesis of this specific neurotransmitter in the GI tract. And then we know zinc is involved in the neurotransmission along this pathway. Magnesium helps to improve the expression of the receptors, so you have more people listening for that. And so if you have this level of detail, you can customize things. And you can look and see how they interact with each other. I said that was the last one, but so I'm going to cut that off for now because I think we could go into kind of an excruciating level of detail. But I show that mostly as an example to say what's possible. Like when you have an individual in front of you and you're trying to figure out what is the next right thing to try, it helps you narrow stuff down and say, this is what's likely to be the focused thing for this individual. The goal is not to write a list of 20 different things that they're supposed to be on, or 50, depending on like how detailed, but to look and say, this is the most significant. Let's try these handful of factors. And you try them in a staged approach. So you won't, just like Silvia was saying, you can't do everything all at once because you'll shock the system. And your system has accommodated to its genetics for a while. But this gives us a kind of a roadmap to move forward. was. And so they had done a genomics test to try to get more.
Okay. So I just want to show one other example, and this one is a case report for a patient who had an adult with more mental health disorders, ADHD and anxiety. And she also had exposure to water damaged buildings and concern for mold related illness. And she had gotten genomics. And if we go back and look and say, well, what does that show? In her case, we were looking at the mental wellness panel. You would think, okay, ADHD, let's focus on attention and focus and anxiety, because she had anxiety, maybe medication responses if you were going to do medications. But the panel gives you a lot more information. When we look at attention and focus, she had one gene variant that does impact focus, and it leads to higher glutamate, which we said is this excitatory neurotransmitter. It affects several other things down the line, but it's not like she had a ton of things that were abnormal. If we go and look at what are the factors that might contribute to an increased tendency for anxiety, there were a handful of things. These aren't super rare. I expanded this up to anything less than about 20% of the frequency. And there's one gene that was related to estrogen receptors, because you need estrogen to help dampen an anxiety response or turn it down. And if you can't receive that signal, it can impact things. She had a tendency to overproduce adrenaline and a tendency for lower serotonin. So we figure out, all right, we want to address those, but they're not super rare things. So is that accounting for everything that's going on in this individual? And then when you look at inflammation, there were numerous hits on numerous levels. That TNF alpha gene that we talked about beforehand came up again. And this is, again, less than 1% of the population. She's got 2 copies of it and way overproduces this inflammatory cytokine, but she's overproducing all sorts of cytokines. And she has difficulty shutting down inflammation once it's been triggered. So if that's the underlying genetics in a patient who then gets exposed to mycotoxins or whatever, like whether it was food sensitivities, in her, it seemed to be mycotoxins, then she's going to have this really exaggerated response. And so how do we customize a plan to treat for her? And if this was the kind of results that I would get, I would think, yes, we want to do something to support serotonin. 5-HTP is a precursor that can help support that. We want to address cortisol, which is a stress hormone, and GABA, which is that calming hormone. And ashwagandha, which is an herb, has been very helpful in that, and has been used in numerous medical traditions. We talked a little bit about hormone balance, and it would depend on the woman and what was going on. But then I would be leaning heavily into anti-inflammatory approaches and to addressing the root cause of that inflammation, which in her case we think was mold. Right? We would have done a more history, and we'd be looking at food sensitivities and gut health and everything. But I feel like this gives you a roadmap to know where you're going, what you want to treat. And that allows you to get to a much more precise set of interventions. All of this ends up being very actionable, because getting a test that just says, by the way, you're going to get Huntington's when you're older, that may not be the most useful test. But if you get a test that tells you this is a weak point, but here's the treatment, or here's the potential treatments, then it's really useful. I think that also can help minimize the trial and error approaches and help to get some better outcomes. And with that, I'll stop and we can take some questions. Thanks, everyone.